Welcome to this second part of our special on psychotropic drugs, dependence, and the chronicity of suffering. In the first part, we discussed medicalization, symptoms, biological conflict, and emotional suffering. But today we will delve deeper. Because one of the great contemporary questions is this: what happens when human suffering ceases to be heard and is simply silenced? We live in societies exhausted, anxious, and saturated by evil, injustice, and a lack of tact in dealing with other human beings, where the philosophical concepts of alterity and otherness seem to have been swept from the medical vocabulary, where they should be indelibly etched. We have emotionally overloaded, disconnected, overstimulated, anxious, depressed, and often profoundly empty and profoundly ignored societies. Empty of conscience and, logically, of humanism. And during this scenario, millions of people try to survive as best they can. At FARO Integral, we don't work against medicine. We work against dehumanization. Because the real problem arises when the patient, ceases to be seen as a human being and becomes merely a diagnosis, a protocol, a neurotransmitter, or a prescription. There, their right to health, well-being, and a life with dignity is violated. FARO seeks to recover presence, awareness, science, ethics, listening, humanity, and a profound sense of care. Suffering as a human experience. Suffering is not merely a chemical problem. It is also an existential, relational, symbolic, spiritual, cultural, and biographical reality. Buddhism profoundly developed this understanding of human suffering. Taoism also observes that suffering arises when human beings lose harmony with their essential nature and live in constant resistance to the flow of life. In medical and philosophical Taoism, illness often arises when the individual disconnects from themselves, represses their truth, cannot be authentic, lives in excess, or lives in suboptimal conditions. At its extremes, balance is lost, and one moves away from the natural rhythm of the body and spirit, from the golden mean in all things, in Aristotle's words. The problem is not only physical pain. The problem is the profound disconnection from the self, the emotional pain, often fostered by the environment. FARO Integral Assessment. FARO Therapy performs an integrative, multidimensional assessment, beginning with Western biological medicine. It assesses medical diagnoses, clinical symptoms, risks, current medication, sleep, anxiety, functionality, psychiatric history, and the need for professional referral. FARO never replaces specialized medical care. With the ancient and wise traditional Chinese medicine, the state of the Shen, qi depletion, emotional disharmonies, energy blockages, kidney deficiency, heart-liver imbalances, spleen depletion, mental hyperactivity, and body-spirit disconnection are evaluated. The patient is not seen as an isolated organ. They are observed as a dynamic whole. As an epistemological principle of FARO, it must be remembered that being is a multidimensional whole, the occurrence of illness is multicausal, and therefore, treatment is multilevel. But the FARO evaluation goes even further. It incorporates medical and philosophical Taoism, the foundations of traditional Chinese medicine. It explores loss of meaning, excessive control, disconnection from authenticity, emotional rigidity, difficulty flowing, excessive demands, and lives sustained by adaptive masks. Taoism reminds us that suffering often arises because the person lives too far removed from their true nature. Their being is buried alive. FARO Clinical Intervention. FARO Coach. The FARO Coach works with deep active listening, emotional regulation, pattern observation, body awareness, personal narrative, identity, existential emptiness, habits, the quality of relationships, authenticity, and the meaning of life. They do not diagnose psychiatric disorders or discontinue medication. This is the responsibility of healthcare professionals with university degrees. The coach or facilitator accompanies processes of awareness and human transformation. FARO Nursing. FARO nurses are trained in classical clinical assessment and integrate the clinical assessment of traditional Chinese medicine, having completed a training program. Their qualification enables them to provide therapeutic education, health promotion, and prevention of illnesses and complications arising from treatments. They should perform clinical acts with profound human sensitivity. They monitor subtle clinical changes that occur in the patient and promptly inform the healthcare team. Their clinical skills allow them to intervene in stress management, emotional support, the promotion of healthy habits, and holistic care. FARO nursing does not only treat symptoms. They care for people experiencing suffering. They develop a realistic, individualized care plan and make necessary adjustments based on ongoing observation. FARO professionals. All FARO professionals, those who adhere to this model and are trained in its method, work interdisciplinarily, integrating science, ethics, humanity, complexity, and conscience. They analyze what is best for the person they serve, considering them as the recipient of their service. They analyze the benefits and advantages of therapy and develop an individualized plan. The goal is not to impose therapeutic ideologies. It is to responsibly accompany human suffering and provide solutions, not palliative care. The patient or client must participate in their care and always give their consent. Subscribe to the channel. Don't forget to like this video. Comment below where you're watching from if you're a healthcare professional, and let me know if you'd like to train as a FARO coach. Share this video to help raise awareness. Study with ESSI, the FARO Integral Method. Learn science with awareness. Because in healthcare, knowledge isn't neutral. It's vital. See you in part 3 with therapeutic strategies.